You know what? I think I'm speechless. I've been doing this a very long time, that is, professionally in a variety of venues. And I mean what I'm about to say. It's not hyperbole and it's not disingenuous. I have not sat through a better presented presentation that makes all of us, or should make all of us, so proud to be colleagues in this mission. I'll tell you, unbelievable. I hesitate to ask this question. Did we record this?
Yes, we did. Absolutely. We're on
Fabulous.
it.
Fabulous. I mean this sincerely. Each of you who presented is going to get a note from me, only because I want you to understand how strongly I believe not only in this work, but what you've contributed to our communities. You know, I sat here thinking about the glamorous aspects of our organization. And believe me when I say this, heart transplants and kidney transplants are important. But if you add those two incredible clinical activities together, you affect 500 or 600 patients. You do that on an hourly basis. You offer jobs, you offer commerce, you offer support. It's unbelievable. And so, as much as we tend to pride ourselves, and rightfully so, on our clinical care, what the collection of all you and your colleagues and your commitment actually does is affect millions of people. That's not an exaggeration. When I look at the hours on our construction jobs, and by the way, I don't know that I've ever sufficiently thanked the supply chain folks for all that they did in this pandemic. Bob, you and your team have been beyond heroic. But now to effectively pivot and intentionally ensure that our supply chain supports our social commitment is something above and beyond what anyone would have thought of. You know, when I listen to this, I think 5 years ago, for argument's sake, these numbers were at zero, basically. You know, we're anxious to see numbers that are big in everything we do. We like to see big numbers and accelerated pace of accomplishment. But we've come from zero to these numbers, effectively zero. And so we're allowed to step back and say to ourselves, that is you all, good work. You know what? We're making a difference. We're doing it appropriately. We're keeping the right records. We're analyzing the right data. We're supporting the right people. And we're certainly supporting the right programs. So I'm telling you, I guess I've said a lot for a guy who said he was speechless, but I got to tell you something. This is the pride-provoking highlight of a long period of time in my life. So congratulations, everybody. Thank you for this. Just outstanding work, truly.
Thank you so much, Barry. Thank you, everyone who presented and everyone who joined and listened in. I do want to, again, say, please shop locally and support our local businesses in your community. I hope you guys get a lot of good, full socks, holiday socks. But, just again, saying thank you to everyone. I know this work isn't easy when we're the first. To be honest, we have a competitive advantage compared to the other hospital systems in New Jersey in doing this work.